I knew the reason why I wanted to get rhinoplasty was basically because I had a nose that was just out of balance with the rest of my features on my face. And so I just wanted to achieve a more balanced, more defined nose.
But first, Jill needed the right doctor. And she knew she could find one in Washington, D.C., where 60% of its population is made of African Americans. No other city in the country embodies power and beauty for blacks quite like D.C.
My biggest concern was that I would not find a physician that would understand what my needs were, that would probably overly pinch the nose or perhaps make my nose too narrow and just not a nose that went with my face.
There, Jill met with plastic surgeon Dr. Monty Harris and got all her questions answered.
Jill presented with not concerns, but wanting to improve the balance and shape of her nose. And her goal was to just achieve a little bit of narrowing in the bridge and a little bit more refinement in her tip.
Dr. Harris put Jill at ease after discussing the procedure and giving his own natural look approach.
It's not the type of operation that I want people coming up to my patients saying, "Hey, did you have your nose done?" But my patients really recognize the changes that we've made and appreciate the changes. The taboos of cosmetic surgery with African Americans primarily relate to this loss of cultural identity or racial identity. And from the standpoint of those type of procedures that may have that impact, primarily centers on rhinoplasty or nose reshaping, and people that may endeavor to change the shape of their nose, somehow that causes them to lose a little bit of who they are as an individual. So the majority of the taboo has focused around rhinoplasty for African Americans.